Hello everyone, this is Dr. Mohsin and today I'm going to teach you how to do the abdominal examination. As in every examination, first we need to explain the patient, what we're going to do, the position, the exposure and the chevron as well. So here we need to tell the patient that I'm going to touch you, I'm going to look at your tummy, I'm going to tap your tummy and listening to the bowel sound of your tummy as well. Next position would be patient will be lying on his back and we need to expose the patient from mid chest to the mid thigh. And last thing is, member medical team will be with us to ensure the privacy of the patient. Now doctors, we are going towards our examination. First of all, we need to inspect from the foot end, look for any redness, any swelling, any changes, comment on the shape of the tummy, umbilicus, visible pulsations, scar marks, then do the same from the right side as well. Then ask the patient to cough to see for hernial orifices as well. So after the inspection, next we will move towards the palpation. So here doctors, we will be doing the superficial palpation to see for tenderness, deep palpation to see for any masses, then feeling for the organs, any hepatomegaly, splenomegaly, then we will also doing some special tests like Murphy's sign and McBurney tenderness to see for acute appendicitis. So first we will start with the superficial palpation. Ask the patient if he's in any pain anywhere. Move your hands, start from the left iliac fossa. Start superficial palpation. For any tenderness, look towards the patient's face all the way to the right iliac fossa. Next is deep palpation to see for any mass. Ask the patient to take nice and easy breaths and you will be pressing when patient inhales. So start from the left iliac fossa, coming all the regions all the way to the right iliac fossa. Next, doctor of deep palpation will be doing the palpation of organs. We will start with the liver, start from the right iliac fossa, move upwards. Normally you will be not able to feel the liver. If you are able to feel the liver, then you need to calculate the span of the liver. So how to do that? If you are able to feel the liver here, then you need to percuss from right iliac fossa. And wherever the knot become dull, then this is the lower border of the liver, then you will find the upper border of the liver. Start percussing from the center intercostal space. Start moving downward and mostly you will find the upper border in the fourth intercostal space. So if you are able to find the upper border here, this is the lower border, this is the span of the liver. Alright, and normal span of the liver is 12 to 15 centimeter. Now we are moving towards spleen. Start feeling from the right iliac fossa, move towards the left hypochondrium because spleen grows obliquely. So after place your hand behind the bag and press under the costal margins as well. Alright, so this is to see for any enlargement of spleen. Next thing is palpation of kidneys. So this is will be my bimanual compression. So one hand here and press to feel if you are able to feel the kidneys. Next, one hand here, second hand here and feel for the kidneys. After the kidneys, doctor, next is Murphy's sign. Murphy's sign will be positive for acute cholecystitis. Simply we will place our hand below the 9th rib and we will ask the patient to take deep breath. And if patient feels pain on deep inspiration, this means Murphy's sign is positive. This is positive for acute cholecystitis. Next is we are going to check the McBurney point tenderness. So McBurney point is basically, so this is umbilicus, this is anterior superior iliac spine and the later 1/3 this is the McBurney point. And it has a significance that if patient is having an inflammation of appendix, there will be tenderness here. So we will press to see if there is any tenderness at McBurney point or not. So we are done with the palpation. We have done superficial palpation, deep palpation, palpation of organs. We have done the Murphy's sign and McBurney point tenderness as well. Now we are going towards the tapping, the percussion part. So doctors, two important tests here. One is shifting dullness and second is fluid thrill. So how to do this shifting dullness? If patient is having any ascites, any fluid in the tummy, we'll start from the xiphi and see, place your hand horizontally here and start tapping. When you reach the umbilicus, then you need to move your fingers vertically and then start percussing towards the side. Alright. So when the knot become dull here, you need to ask the patient to turn towards your side and you should wait for 30 seconds. Alright. and after that you will again start percussing towards the midline. And if the note become again resonant, it means shifting dullness is positive, it means there is fluid inside. Alright, so next test is fluid thrill. Here we will ask the patient to place his hand here, the midline, to avoid any waving of the fat. Alright, patient will be placing hand here, and we will be placing our one hand here, and we will be tapping on the other side. If we feel any wave under our hand, it means there will be fluid inside. Alright, so this is the percussion part. Now last part is auscultation, listening to the vowel sounds. So listen to the vowel sounds along the umbilicus. Okay doctors, ideally you should listen for 2 to 3 minutes to actually comment that there is no vowel sounds or exaggerate vowel sounds. Alright, so this is all from the abdominal examination. Thank you so much.